Auayan, and today we're going to talk about the effect of COVID-19 in dental clinics and how they survived the pandemic. So in December 2019, the novel coronavirus was identified in China. Soon after, in February 2020, the virus spread to Europe, and finally on 11th of March 2020, the World Health Organization called it COVID-19 and declared it a pandemic. By 25th of March 2020, the country with the most confirmed COVID-19 cases was the United States, with 81,864 cases, and in Italy was the most affected country in number of deaths. That is with 74,386 cases and 7,503 deaths. Health system capabilities and performance were the main issue in all the affected countries, and in the interest of flattering the curve, meaning to decrease the number of the new cases and hence the number of patients requiring hospitalization. Restrictive measures were put in place, so the restriction consisted in flight limitation, borders closing, shutting down cafes and restaurants, closing of schools, and self-isolation at first and restriction of movement afterwards, with a total lockdown being the last resort. The dental practice was identified as working place with the most potential high risk of cross-infection, as face-to-face communication and consistent exposure to the body fluids such as blood and saliva are frequent and common in dentistry. COVID-19 transmission in dental setting was described, and it was assessed that it occurs through four major routes. So first, direct exposure to respiratory secretions containing droplets, blood, saliva, or other patient materials. Second, indirect contact with contaminated surface and/or the instruments. Third, the inhalation of suspended airborne viruses. And fourth, the mucosal, nasal, oral, and conjunctival contact with infection containing droplets and aerosols that are produced by dental procedures. So here in the Philippines, as mentioned in other countries, the government implemented lockdowns in every areas around the country. My hometown, the city of Puerto Princesa in Palawan, as I worked as a dental assistant in a private clinic, and I noticed and experienced the impact of how COVID-19 changed the working ethics in dental clinics. So first, due to health restrictions, the local government implemented to stop the operation of every private dental clinics and requested patients with emergency needs to proceed in the nearest public hospitals, that is for the treatment. Since it was ordered by the officials, our dentist, the owner of the clinic, decided to close the clinic. So second, the problem is that we are the employees loses our job for almost 3 months and not knowing how to support our daily needs. Though we are provided a financial assistance from our boss and also a relief goods from the local governments distributed house to house by the barangay volunteers. And third, problem was many of our patients with orthodontic treatment ongoing are reaching out because of experiencing difficulties with their braces. Some has bracket fall out, their ortho wire are long enough that is hurting their gums, and some are having toothaches and they can't explain why. So even our boss is having a serious problem also in losing her business. She decided to open an online consultation for our patients for at least to address their concerns and advise them a home remedy if it can be, or referring them to the nearest public hospitals if there is an emergency treatment needed. So after almost 3 months of lockdown, the government decided and let the private dental clinics to operate. So we, in our clinic, have announced to the social media that we are back in operation. Many of our patients have messaged and called us for them to have an appointment. We have encountered a lot of oral problems, so those are the patients that are afraid to go to the hospitals for some health issues. But before we let our patients to have an appointment with us, we advise them to have an antigen test and require them to wear PPEs or the personal protective equipment. That is for their protection and also for our safety in the clinic. We have set new health protocols upon entering the clinic and guidelines for our patients. So COVID-19 maybe brought us hassle environment from wearing mask and face shield all the time to protect us from the virus. And us in the health industry being the frontliner from wearing not just the mask and face shield, but full set of PPEs that we are required to wear every day for 8 hours. So even going home from work, we need to adjust before or because we have members of the family that is prone to the virus. But there are a lot of things that this pandemic taught us. So we are able to spend time with our loved ones. We have plenty time to ourselves to take some rest. We are able to access the usage of social media for our needs. And of course, we let the Mother Nature to rest for a while. As countries introduce measures to restrict movement as part of efforts to reduce the number of people infected by the COVID-19. More and more of us are making huge changes to our daily routines. So well, that being said, everything's happened for a reason. Just be ready all the time for us to handle this kind of situation. Thank you.